Hey everyone, Jen here. Hope you're having a good Friday and looking forward to a good weekend. One of the things that I'm hoping to do is to share a little bit more with you about important medical information, essentially medical news you can use, and hopefully an easily digestible way. So, going to use my social for this more and more. I hope you'll be on the lookout. And the first thing that I thought I'd share today is to get us started is an exciting new announcement that came from the FDA. And in fact, what happened today is that the FDA approved two gene therapies for the treatment of pretty serious uh, medical issues. And particularly, I get interested when it's related to pediatrics. And what's exciting is they approved a new gene therapy for sickle cell disease. So, first of all, what are gene therapies? You might ask. Well, genes, those provide important information or instructions, you might think, to influence everything about our bodies, how our bodies work, whether or not we might be at risk for a particular disease or illness, whether or not our eyes are blue. And so gene therapies can actually alter the genes when they go awry and cause problems so that you can either treat or potentially even cure diseases that have a genetic start or basis. So, what happened today is the FDA approved a gene therapy called CRISPR, which essentially edits a person's genes. They're taken out of their body, they go through this editing process, and then are put back in the body so that healthier genes that have been edited hopefully can now work in your body. And particularly, what's happened for sickle cell disease today is that this therapy that was approved essentially turns on genes that otherwise had become dormant through this editing process to create something called fetal hemoglobin. Well, why is it doing that? Well, in sickle cell disease, it's actually an abnormality of the red blood cells. And our red blood cells are critical for taking oxygenation or taking oxygen to our tissues. And what happens in sickle cell disease is that an abnormality of the hemoglobin, which is the protein in red blood cells that actually carries oxygen to your tissues, is abnormal. And it causes the cells, instead of being round and soft, to become C shaped or sickle shaped and firm and hard. And what that does is it's not just a structural problem, but because the red blood cells are altered in that way, they don't carry oxygenation or oxygen as efficiently, but they also can cause something called sickling, where they can get stuck and kind of aggregate in the smaller blood vessels. So that can lead to pain in your body, right? And all these red blood cells get stuck together and decrease oxygenation, significant pain crises, which can be very painful for patients and can have other complications. What are some of the other effects? Well, not only do sickle cell patients suffer from pain crises, they can also suffer from something called acute chest syndrome, where it affects respiratory function and you can go into severe respiratory distress, can be life threatening, and even having stroke. So there are a lot of complications from sickle cell disease. And this new therapy, what it does is it actually, because it edits the genes, it actually puts genes back in your body that help to create fetal hemoglobin. And what fetal hemoglobin is, just as it sounds like, the hemoglobin, the type of red blood cells that our body makes when we're in the womb. And for all of us, we have created fetal hemoglobin when we were as babies. It actually carries a lot of oxygen to our tissues. And what normally happens is that between 6 and 12 months of age, our body stops making fetal hemoglobin and it transitions just to adult. Well, by turning on the production again of fetal hemoglobin, we can now essentially decrease the effects of sickle cells in a patient with sickle cell disease. It can outnumber and help to provide better oxygen delivery. So this is pretty exciting, this gene therapy that just was approved today for so many patients. I think what is really exciting is that the future of gene therapies is just so great. And if you're interested, like me, in learning about what's out there from a gene therapy perspective, I encourage you to check out my next podcast at Boston Children's Answers Parentcast. We have the next one coming out on gene therapy. And in this podcast, I'm going to get to interview Dr. Christine Duncan. She is medical director for the clinical research and clinical development program at Boston Children's Gene Therapy Program. So we're going to talk all about how gene therapy can address rare and complex diseases. So I hope you'll tune in. Looking forward to seeing you all soon. Have a great Friday. Thanks for letting me share my medical minute.